everyone, it's me, Dr. Kahng, cosmetic dentist, and welcome back to my channel. Today I'm going to talk about white spots, those pesky white spots that are on your teeth. What are they and how do you get rid of them? If you want to watch, stay tuned. Before we move on, if you haven't already, hit the subscribe button so you don't miss any of my future videos on cosmetic dental procedures. Now, I recently did a white spot reversing procedure on an actress, and when she saw the result, she cried. And she said, I just didn't even realize I could get rid of the white spot, and I didn't realize how much I hated it. But the truth is, white spots occur for different reasons. So in this video, I'm going to talk about what your white spot possibly could be and how we can treat that white spot. When I talk to patients about their white spots, I commonly find that they first try to whiten their white spots. And you want to be very careful with teeth whitening or have an understanding of how teeth whitening is going to impact those white spots because they will all react differently depending on what the white spot is. To keep this video simple, there are 3 common reasons for white spots. The first reason is hypocalcification of the enamel. Hypocalcification of the enamel is where the enamel is missing enamel crystals, and because those are missing, it's more porous and soaks up whitening solution like a sponge. These areas end up looking much brighter after teeth whitening, like super white. The reason for hypocalcification in most cases is because of oral hygiene, especially after braces or during braces when the plaque is not fully removed from the bracket. If the plaque is not removed around the bracket on a daily basis, it can cause demineralization of the enamel, and so when the bracket is taken off at the end of braces, you will see a little square white spot right in the center of your tooth. Like I mentioned, these white spots are like sponges and they will get even brighter with teeth whitening, which may be quite alarming. But another thing I want people to know is that if you try to whiten a tooth with one white spot, there are most likely other white spots that are not quite as apparent just yet. But those white spots also absorb the hydrogen peroxide and become more apparent after teeth whitening. So what I want people to know is that teeth whitening did not cause the white spots. The white spots were always there, but they are just made more apparent with teeth whitening. The second reason for a white spot is fluorosis, where fluoride accumulates within the tooth during the maturation phase of tooth formation. These are tricky to treat because the fluoride has basically become part of the hydroxyapatite molecule, forming fluorapatite. And what that really means for you is that if you try to whiten this type of white spot, the white spot will become really bright, just like in the first scenario, but the surrounding tooth structure, because it's changed molecularly, will not whiten as much. So the contrast is even more. So just be aware that that may happen if you decide to whiten your teeth. The only whitening system that I would really recommend for somebody who has fluorosis or is attempting to whiten with fluorosis is the core whitening system. The third type of white spot is from enamel hypoplasia, where a certain type of antibiotic, usually in the tetracycline family, is taken during pregnancy or early childhood. Similar to fluorosis, this will molecularly change the hydroxyapatite because the tetracycline family chelates strongly to the hydroxyapatite molecules, making it very difficult to whiten. Now that we've covered the 3 main reasons for white spots, how do we treat them? One treatment method is called Ikson from DMG. It is basically a white spot reversing treatment that is very conservative. The patient just comes into the office, we will isolate the area so that none of the solution gets onto the gums, and then we will treat the white spot through a series of different chemicals and let the white spot reabsorb and reinforce with resin. Now, in my experience, there are some white spots that are so deeply ingrained in the teeth that this treatment will not fully cover it up, in which case I have other methods to combine with this treatment. So I use this treatment as the first go around. The pros of this treatment, again, is that we're not having to drill the teeth and there's no anesthesia involved. And then afterwards, I'll see how much of the white spot has disappeared. And then I'll plan an additional restorative treatment to piggyback off of what we have already done. Overall, I think Ikson is a really cool treatment because other than that, there are 2 more treatment modalities that I think most people use. The second most common treatment with a white spot is to microabrade it or to drill it away and to cover it with a composite bonding. Now you can see why Ikson is the preferred method because drilling away enamel always kind of hurts our hearts because once the enamel is gone, it does not come back. However, it's not the worst case because we try to keep the drilling very minimal and only around the white spot, just enough so that we can cover it back up with composite bonding. One thing you may want to know about composite bonding is that the filling material that is used to cover up that white spot will stain over time. And so it does need to be replaced frequently depending on your habits at home. So if you are drinking a lot of coffee or a lot of wine, that composite may stain and need to be replaced. Now let's say that you want to whiten your teeth. That composite will also not change color and become as bright as your tooth. So just keep that in mind. If you do want to do composite bonding, you'll probably want to whiten your teeth first and then match that composite bonding to the color of your teeth. The third option are veneers. Those are coverings for your teeth. And this is a great way to get a little bit more uniformity. And an added bonus is that you can choose a color and a shape that is more flattering for your face and smile. The nice thing about it is that the color is also stable, so it will not be affected by teeth whitening, and you do not need to refresh that little composite every single time it stains. All right, those are your 3 options. I have other videos if you want to know more about veneers or composite bonding. Most importantly, I just want people to know that if you are living with a white spot on your tooth, you do not have to live with it forever. There are treatments that can help reverse or diminish the look of the white spot so that it blends in better with the rest of your tooth structure. All right, that's it for this video. If you found this video helpful, please hit the subscribe button, hit the thumbs up, and I will be back next time with another video. Bye.